Hello everyone. Today we have with us the renowned gynecologist Dr. Abha Majumdar, who is the director and head of the Center of IVF and Human Reproduction Department at Sir Ganga Ram Hospital, New Delhi. Dr. Abha Majumdar, after completing her MBBS and MS from the SN University, Agra, was awarded with the fellowship of International College of Surgeons in the year 1994 and is the recipient of 7 gold medals during her graduation. Dr. Majumdar is the recipient of Dr. B.C. Roy Award from DMA, Vikas Ratna Award, Chikitsa Ratna Award, Abdul Kalam Medal, and Lifetime Achievement Award by Hippocrates. And there are many more to it. Dr. Majumdar is responsible for the first IVF baby in northern India and is the head of the team responsible for reporting the first IVF baby in northern India from frozen oocyte. So there are questions from our Docplexus members that they would like to ask Dr. Majumdar regarding IVF and surrogacy. And the first question they are looking forward to is, there is a case of infertility, unexplained infertility. So what do you think is the solution in IVF for such case of unexplained infertility after 6 cycles of IUI failure?
Well, thank you, Harshita, for introducing me. And I would say that in unexplained infertility is a major component which comes to IVF after they fail in IUI, and hence the pregnancy rates are almost similar as they should be in other IVF cases. Everything depends on the age of the woman, and at our center these patients have around a 40-45% pregnancy rate in fresh and frozen cycles. The only little glitch or catch here is that these patients do best if we add ICSI to their cycles, at least for half the oocytes where we have a good number of oocytes, because possibly a few cases of unexplained infertility are failure to fertilize in vivo as well as in vitro.
So one of our doctor member has completed his DGO, so he's looking for the courses available in infertility and any books if you can suggest for the same.
Okay, Harshita, someone who's done DGO or even MD in Gynae or DNB, there are 2 major branches. One is clinical reproductive medicine and the other one is that you do embryology. A lot of girls and boys or doctors, young doctors, after doing MD Gynae has shifted into clinical embryology also, which is ordinarily a science offshoot. But embryology has a major component in the treatment of patients with IVF, and hence these are the 2 main branches where these girls and boys, or I would say young doctors, could go for sort of learning or getting into one of the lines which are related to infertility management.
And what is your opinion regarding the gynecology job?
Well, I wouldn't have an opinion. I would only say that don't jump into infertility at the outset. Don't come out with the idea that you want to start an IVF center. Always work in an institution under some guidance of good specialists so that you learn to develop good practice points. And then after say 15 years of having this experience, it is very good to go in for private sector jobs, or I wouldn't say private sector jobs, but private jobs. Even the private sector has institutional jobs. So I prefer that all young doctors should first opt for institutional exposure of the subject and then move into a private sector self-practice if they want to.
So then, since we know that there are not many surrogacy centers in public institutions available, so what is your opinion on that?
Well, the ART guideline doesn't allow us to have surrogacy centers in any institution. This is a very normal thing. Please remember that if there is IVF center, that under that roof, by the same authority, we cannot run a surrogacy center. It has to be away from that, away in the sense, it has to be run by someone else not connected to the ART center. And that is why it is not possible to have in institutions which have IVF center, a surrogacy center also.
So, seems future of surrogacy in India is quite uncertain. What is your opinion?
Well, I think when anything mushrooms very fast, what happens? one removes all the mushrooms. This is what is happening with IVF. Without any guidelines, we have a very fertile brain, and all those who came into the field of IVF and many more who are coming into the field of IVF started growing in all directions, and this technology could be used in so many more indications than what it was meant to be used. And that is where, and it, practically India became the surrogacy capital of the world. Now when you are termed with this big a term and responsibility, all foreign delegates, all countries, European countries who did not allow surrogacy in their own country, their nationals started pouring into India. And who was used by the middleman? The poorer population, women of India, to become surrogates for those children. And hence, at some point of time, the furor rose so much that they had to put a stop on it. So first the stop was put on gay couples, single couples, then on foreigners also to some extent. However, we still don't have an act, we only have guidelines. But we are law-abiding citizens, and even on guidelines, most of the centers have stopped taking patients or foreign nationals for surrogacy. And that is why surrogacy has become a little uncertain in India. But there is no law to say surrogacy is not allowed for Indians living in India or living abroad.
In India, there are still religious beliefs that frown upon the process of surrogacy. But for some families, this is the only way to start a family. So have you ever came across such a situation and you managed it?
Harshita, there is nobody who frowns upon surrogacy, let me tell you. It is people who frown upon IVF. They don't want to disclose to the world that this baby has been conceived by IVF. Because there is a myth which goes on that maybe these babies come from somebody else's sperm. There is, surrogacy has been practiced since a very, very long time in our country, where there used to be surrogates where a sister or a sister-in-law carried a baby for the other sister or sister-in-law who could not produce a child, and they would give away the baby. However, this baby was not genetically related to the real mother. This was genetically that woman's baby who carried the baby. So people really don't frown upon surrogacy. They look with respect when someone does it for altruistic reasons.
Do you think that the art regulation bill should be transformed to the Art Act, and how would it benefit the doctors as well as the Indian society?
Well, it is a sword which has two edges. One is, I think it should be transformed into an act. It will regulate us better, and we are all law-abiding citizens. Mostly doctors are. So once a law is made, we will not try to shift here and there. But then it's a double-edged sword in the sense that if we have an act, then very small things which we could do for patients, we will have very tight borders to follow rules. We want to be a little lax, like if we want to take a donor of 36 or we want to take a surrogate of 36, we'll be on the wrong side of law. So this is what it will do. It will affect us and patients negatively also, because it will make very tight boundaries for us to follow. But in another way, it will also help us that we will not do things which we try to explore at the present moment, making a 70-year-old pregnant or a 60-year-old pregnant. All those things will be probably binded better.
Right. So what are the recent advances in assisted reproductive techniques?
Well, this is one technology which is rolling so fast as far as advances are concerned. And the biggest two recent advances I can foresee is vitrification of oocytes, which is being done for fertility preservation, for delaying fertility, for cancer patients before they go into cancer therapy. So oocyte preservation is getting more and more robust every day. And the second thing which is really happening on this front is that we are being able to do pre-implantation genetic screening of embryos so that we can bring up the pregnancy rates in IVF to from 40-50%, which has been since very, very long, to almost 60-70% by choosing a normal chromosomal embryo to be implanted. Other technologies which are moving fast is being able to choose a good embryo by time-lapse technique, also by PGS. Then We have vitrification technology which has advanced very well, and we have a very good robust embryo freezing program also. So this is on all sides where technology is advancing.
So, how do you counsel a family to go for the surrogacy option just to make them confident about the option?
See, there are two types of counseling which I would do to patients who come and ask for surrogacy or don't ask for surrogacy. One is negative counseling and the other one is a positive counseling. When I say negative counseling, a lot of women just feel that because they failed in IVF 2, 3, 4 times, they need a surrogate. But here I tell them that they don't need a surrogate. Probably they need another IVF, and we need to look in why. Maybe the egg quality is poor, the sperm quality is poor. If the uterus is healthy and the lining is healthy, they don't need a surrogate. So this is one place where I do a negative counseling. Then there is another sector where I do a positive counseling. Positive counseling is a woman comes and says, I want to have a baby, but she doesn't have a uterus. She has absolutely normal, big, nice ovaries, making good hormones, making good eggs, but her uterus is underdeveloped. It doesn't have a lining, or the lining has been destroyed. So these are the women where I tell them that you see, you can have your own genetic baby, but someone else will have to carry the baby for you because your uterus is not capable of carrying this baby. Then there are some women who come with, say, transplants, renal transplants, or with end stage renal disease, or with a eye disease which would get aggravated in pregnancy, and we would never want a woman to lose her eyesight in pregnancy or lose her kidneys in pregnancy. So such women are also advised against carrying the pregnancy themselves, and they move into for surrogacy.
So you have such a vast experience. So during your practice, have you ever come across any special case that left a lasting impression on your mind?
Special case in surrogacy?
Yeah, in surrogacy.
Okay, well, we come through these cases every day, and the biggest example is that ICMR guidelines which were made in 2005 and 8 said a surrogate's mother could be as much as 45. They brought it down to 35. This is because a woman less than 35 can cope very well with complications and she can still live after them, whereas an older woman may not be able to cope with complications. One or two cases which I can remember is one case where a woman had multiple miscarriages and we could find no reason for her miscarriages, eventually opted for surrogacy. This was after 7 miscarriages. And on one side, the surrogate got pregnant, and the woman didn't tell us, but she also got pregnant on the same hand. And this pregnancy continued without any problem for that woman, whereas the surrogate in her 6th, 7th month developed severe hypertension. We had to do a cesarean for her, deliver a preterm 900-gram baby because we had to save the life of the surrogate. She developed such a lot of complications in relation to pregnancy-related hypertension. And on the other hand, this woman who had miscarried 7 babies carried this baby to full term and delivered her normally. Just look at the irony that this surrogate had delivered 2 babies normally, and the 3rd baby, where she was a surrogate, had to have an emergency cesarean section just to save her life because her blood pressure was intractable, uncontrollable. So this case has a lot of effect on my mind, and I hope we don't lead to more complications.
So how important do you think is the legal team in handling surrogacy cases on daily basis?
Very important. Not really on a daily basis, but when we start a case of surrogacy, then we need legal documents, agreement between the intending parents and the surrogate to be made. And at the end again, especially when foreign nationals were coming in great numbers to our country, then we needed the legal team again, the FRRO people to come and sort of certify all documents, make sure that everything was in order and they could take the child safely back home.
So, as compared to foreign countries, what is the percentage of Indian couples opting for surrogacy?
Well, I would say I would be a very bad person to answer this question. Because we really don't take up surrogacy in that big proportion. Ours is basically a good IVF center where we do almost 150 cycles a month and about 1200 to 1500 cycles a year. But surrogacy is, say, about, I would say, 20 cases a year, and we generally take people who are of our own nation, some foreign nationals also, but centers which take only surrogacy as their primary IVF job, they are the ones who would be able to answer this question, that what is the percentage. But let me tell you, till now foreigners have been much higher in such centers rather than our own Indian nationals.
So, what were the challenges that you faced being an IVF specialist and now you being the director, when most of the Indian population even don't know about such a process of reproduction?
Well, now awareness is increasing every day, and thanks to people like you, the media, the internet, the newspaper, where this news is splashed. And a lot of times I have patients who come with cutting of newspaper cuttings, and they say, oh, we read about this and we heard that you do this, so we're coming. So the scene is changing in our country also, and everybody has a mobile phone and everybody has an app, so lots of people do get information about everything on the internet, on the phone, on the newspaper. So the whole scene is changing now. When I started, we were the first ones in northern India to start IVF, and I remember my senior telling me that it's all or none. Either in 2 years you will give up everything and just do IVF, or you will have to close down IVF and go back to the general obs and gynae. However, the first thing came true for me, and we went on working, struggling, grew from strength to strength, and today ours is a center which has almost 35 persons in it working towards all infertility problems endoscopically, treating them treating them medically, treating them surgically, and treating them by IVF and egg donation and surrogacy, everything.
Great, we really congratulate you for that. So lastly, what message would you like to give the 10,000 gynecologists we have on Docplexus platform?
This is the most difficult question, Harshita. Well, I would only say one thing, that please don't try to have very rapid success. Success always takes its time to develop, and when it develops over a time period, it stays. So be slow, but read a lot, apply all that reading and that academic knowledge into your daily practice. Don't deviate into what common practices others use. Whatever you read and you think is correct, use that, and you will definitely succeed.
Thank you so much, Dr. Majumdar. We are really thankful to you that you share your insightful experiences and knowledge on IVF and surrogacy. And I'm very sure that our doctors at Docplexus are really looking forward to hear and learn from your experience.
Thank you so much for the interview.
These interviews and events are featured exclusively for the members of Docplexus community. To receive upcoming updates of such events and interviews, please subscribe to our YouTube channel, like us, our Facebook page, and follow us on Twitter. Happy Docplexing!